Okay, I guess we'll go ahead and get started. Good morning, everyone. I'm Cornelia Sigworth with the Bureau of Justice Assistance, and I'm thrilled to have you in our session today to talk about some of the resources that we have for law enforcement and mental health collaboration projects. I'm joined today by Robin Engel with the University of Cincinnati and Terry Lynn from the Council of State Government's Justice Center. So I think today what we'll do is I'll go through my piece of information on the Bureau of Justice Assistance and what we're doing, and then I'll hand it over to Robin, and Robin will hand it over to Terry. So if at any time you have any questions, please just raise your hand and let us know. And with that, I'll go ahead and get started. As I mentioned, I'm Cornelia Sigworth with the Bureau of Justice Assistance. I'm an Associate Deputy Director at BJA. Let me just put this over here. So BJA, for those of you who are not aware of the work that we do, we're part of the Department of Justice, and I understand this is an international conference. So the Department of Justice is our federal level entity that deals with our law enforcement and prosecution pieces. But for the Bureau of Justice Assistance, we are a non-legal part of the Department of Justice. We provide training and technical assistance and grant administration to state and locals primarily across the criminal justice system. But within the Bureau of Justice Assistance, my team focuses on the law enforcement pieces. The Bureau of Justice Assistance is part of the Office of Justice Programs. So there are sister agencies that you may be familiar with, but today we're just really going to talk about BJA and what we have available. So BJA primarily makes grant awards, as you may primarily know us for that. That's not all that we do. And we make them in two types. One is a discretionary award type, which is a competitive process. These are grants where a solicitation goes out and applicants apply to receive the funding. And then they go through a competitive process. They are externally peer reviewed. And then from those peer reviews, applicants are selected. We also do formula grants, but I'm not going to really speak about those today. Within the Bureau of Justice Assistance, as I mentioned, we cover the entire criminal justice system. We do have a justice and mental health portfolio. And that's what we're going to talk about today. And Robin and Terry are part of our partners on that portfolio. The Justice and Mental Health Collaboration Program is our main grant program under this portfolio. And it really comes from the 2004 Mentally Ill Offender Treatment and Crime Reduction Act. Through this program, we have awarded nearly 600 grants over the years. These grants range in size from small to large, but up to 700,000 at some points. This program really covers building justice and mental health collaboration programs across the spectrum of the criminal justice system. But we have awarded over 100 law enforcement agencies through this program. As I mentioned, that the JMHCP program is the main funding entity and funding vehicle. So you will see a solicitation coming out this year. This year, we're sort of bifurcating the program. So when you see the Justice and Mental Health Collaboration solicitation, that's really aimed at everything post law enforcement. So we're really going to be moving that to the latter parts of the system. We expect to make about 20 awards and in the range of about 550,000 for each project. And then this year we're releasing a new solicitation, which is a subset of the JMHCP program called Connect and Protect Law Enforcement Behavioral Health Response Program. This really is to set up a program specifically for law enforcement to develop innovative responses. The program itself requires that these be law enforcement and behavioral health responses. So the legislative authority requires that they both include a criminal justice entity and some sort of mental health provider. So there are some models that I know are sort of innovative and new that are out there that would not necessarily fit into that paradigm, but for this program, it does require both components. That doesn't mean it has to be a co-responder model. It could be, varying different models, but it just needs to have both partners involved. So as you can see, we are expecting to fund models that include co-responder teams, crisis response teams, crisis outreach teams, case management teams, integrated 911 dispatch. So really a variety of programs. They just need to have both partners involved. We're expecting to make about 36 awards under this opportunity, and the average amount we would say is probably going to be $550, no more than that. So we're looking forward to this new solicitation. In addition, Congress gave us funding this year to launch a crisis response training program. So this is the Collaborative Crisis Response Training Program. You'll hear a little bit more about this in depth from Robin Engel as she talks about what they're doing. So this is really building on the work that Robin's going to talk about. Robin and BJA are in the process of developing a crisis response training curriculum. And that curriculum will be the foundation of the awards that we make under this program. So departments will be able to come in for up to $150,000 to implement that crisis response training. And again, this is a brand new program. We expect this to be released in the next 30 days or so. I also just wanted to, those are our sort of main two funding vehicles under our Justice and Mental Health portfolio, but I also wanted to touch on a couple others that are related, and that is the Stop School Violence program. This is a really large and important program that BJA runs. It's got about $75 million behind it, so lots of awards and lots of opportunity here. And these programs focus on crisis response teams in schools as one of the things that that grantees can do with the funding. In addition, threat assessments and training to improve school climate. So a lot of variance and opportunity here. Just want to make sure everyone was aware of that one. And lastly, tangentially related is our Kevin and Avante program, which focuses on reducing an injury and death of individuals with dementia and developmental disabilities, folks that tend to wander. So this program provides funding for public awareness campaigns and locative devices. So you can actually set up a locative device program with this funding. These are about $150,000. So what's next? We expect the solicitations coming out in the next 30 or so days. We have a new grants management system at OJP this year, so it's a little bit more complicated. It's a two-step process. I really would encourage everyone who's considering applying for funding this year to take a look at our website and those processes and familiarize yourself with it now, because it is brand new for us and for the applicants. And we anticipate that these solicitations are usually open for about 60 days. But much more than grants, grants is a key function of what BJA does, but the other really critical piece of the work that we do, especially in the policy office, is really to partner with national organizations and subject matter experts to provide technical assistance at no cost to folks out in the field. So practitioners who need any kind of help, we're really there to provide that. And I often get a lot of questions like, what does that mean? What is technical assistance? And you'll hear about this from Robin and Terry today in depth. So I'm not going to spend a lot of time talking about it. But that's why we have them on this program today, to talk to you about what we're able to offer you. But I like to think of it as sort of a very large consulting firm, and we're able to go out and provide that subject matter expertise as needed in both short and long-term engagements. Just in terms of our funding opportunities, here are some key websites where you can find those grants once they're posted, those grant solicitations, and prior year award data, and just Crime Solutions is a great place to go for a look for evidence-based practices that you may be interested in implementing. So just check out these websites when you get a minute. We have an entire applicant education series, a number of webinars that go into depth about a lot of the other programs that we have that you may have an interest in and the processes for applying. So I would encourage you to go look there. And then lastly, everybody always asks me, like, what's the secret? The secret to getting a strong proposal written and submitted and funded really is to understand the process. And the best way to understand the process is to serve as a peer reviewer. And we are always seeking experts and expertise, and you get paid for it, and it's pretty good pay actually. And you learn a lot in the process. So I would encourage anyone who's interested in being a peer reviewer to, just submit this information to this email address, and we will add you to the database. And then the more information you provide, the better we are able to identify peer reviewers in the database, because it's a searching process. So, I'd really encourage you to do this if you have the time. And lastly, please stay connected to BJA and what we're doing. And we issue all of our solicitation announcements, everything through Facebook and Twitter. So you can follow online there if that's your means of getting information. And with that, I am going to turn it over to you, Robin. If you want to just take a minute to talk about, introduce yourself and your project. Hold on, let me get your PowerPoint up.
Great, thank you so much. Well, actually, while you're doing that, Cornelia, while you're pulling up the presentation, I do want to start just by saying that I have a very heavy heart today. With the mass shooting that we just experienced in Boulder, Colorado, coming on the heels of the mass shooting in Atlanta, I just want to take a moment to reflect on the lives lost, but also our brave first responders, one of whom we also lost with the Boulder Police Department. Maris Harold is the chief out there, and she was the former chief of the University of Cincinnati, which is where I am, and a former captain of the Cincinnati Police Department. She is well known and loved here, and we have every confidence in her that she will be able to lead her community and her law enforcement agency through this crisis. But it just really emphasizes, again, in real terms, what our work is and the importance of this work. And so everything that we do with our research team is designed to help make police-citizen encounters safer. And so that's what I'll be talking about a little bit today with the new work that we're doing. Now, Cornelia, I can see on my screen that it's actually the wide share instead of, it's kind of cut off a little bit on the screen for my presentation. And I'm not sure if we're able to fix that or not. If not, we'll just go with the flow. But let's see if there's a way to fix that a little bit.
Let me see.
Well, and so
listen, you've really reached my technological limits here.
She's already doing me a great favor, because for those of you who are listening in before we started, I couldn't get my screen to share appropriately. So she's already doing great. Yes, that's perfect. That looks great. Okay. Thank you very much. So we all know that for police officers responding to situations involving individuals with behavioral health issues and or intellectual and developmental disabilities in a safe and effective manner can often present really significant challenges. And so our work, sponsored by BJA, is to take on those crisis situations, but also just overall interactions between police and consumers of behavioral health services and intellectual and developmental disabilities. So although police are routinely responding to these calls, there's a lack of resources and a lack of knowledge for these encounters. And this really is a troublesome reality that law enforcement agencies are dealing with. So to help fill that gap, we have engaged a number of members together on my team that I'll speak about in a moment to develop the academic training to inform police responses. Now, this is designed as a national curricula, and it has a whole host of not just training, but also additional resources and tools that I'll be talking to you about today. So if you'll take me to the next slide, Cornelia. And so what this training is actually designed to do is to support police agencies as they develop and they deliver multi-layered responses to people with behavioral health conditions and intellectual and developmental disabilities. And how this is a little bit different is a lot of times we've been working in the mental health and behavioral health fields, but we've often neglected those with intellectual and developmental disabilities. So this is really a blending of these two different areas with different types of service providers, different types of models. And so blending this curricula together will be the first of its kind. And what we want to do is emphasize the collaborations that are needed between the police, behavioral health, and disability stakeholders. So all of our work is designed to help emphasize this collaboration in whatever type of response model that individuals and communities are engaging in. And then finally, to share information on evidence-based, but also best practices in collaborative crisis response. Now, what do I mean by evidence-based versus best practices? Well, we know that there's a lack of evidence sometimes. So we are sharing best practices, but we need to continually test to see whether or not these responses are effective, efficient, and equitable. And so that's where our evidence base really comes into play. Next slide for me, Cornelia. So we have a great team that we've put together at the University of Cincinnati. And to tell you the truth, at the University of Cincinnati, this is a relatively new space for us. We have been working with police departments for decades, helping them improve police responses, reduce violence. But the behavioral health and intellectual developmental disability space was a little bit new for us. So we brought on a team of experts. Probably very familiar to many of you, Policy Research Associates, or PRA. They're out of Del Mar, New York. Now, this is a small female-owned business, but it has a national reputation for providing training, technical assistance, and conducting research and evaluation. They've been at this work for over 30 years and have really developed an amazing reputation, particularly in the field of behavioral health. They're partnered also with the ARC. Now, the ARC, we are working with the National Center for Criminal Justice and Disability. The ARC of the United States, for those of you who are international members, you may not know that it's one of the oldest and largest national nonprofit organizations that support people with intellectual and developmental disabilities. And so bringing to the behavioral health folks, experts, and the IDD experts together into one team really gives us an added advantage to make sure that we're reaching different populations. The ARC has been doing this type of work, as I mentioned, for many years now. They support over 600 chapters and networks through their work. And then finally, we have the IACP. The IACP is the International Association of Chiefs of Police. And again, for those of you who may not be aware of this organization, IACP is the largest a police executive membership organization in the world. They have over 33,000 members now, and they represent 165 countries. Now, the IACP and the University of Cincinnati already have a pre-existing relationship. Full disclosure here, we do a lot of work with our partners at IACP, and I actually run the Center for Police Research and Policy that's affiliated with IACP. So this team has come together, and thankfully, with the partnership with BJA, I think we're going to be able to do great things for the field. So let's talk about what some of those things are. Our objectives in this project is to address the needs for police training and resources on collaborative crisis response. And again, there's lots of different models out there, and we're going to be trying to develop tools and resources for all different types of responder models. But we also want to raise awareness in the policing community about the nature and the needs of people with behavioral health conditions and with intellectual and developmental disabilities, and again, make those encounters safer. To do that, we're supporting the use of evidence-based and best practices in community response for these populations. Next slide for me, please. So what are we actually going to do? Well, we have 4 specific goals in mind. First, we are developing and evaluating a law enforcement training in collaborative crisis response. And Cornelia referred to that previously, and I'm going to give you a little bit more detail about what that looks like. But we're also providing police training and technical assistance along the way across response models. We'll be developing new technology solutions as well. We know that not everyone can sit in a 40-hour training for their law enforcement agencies. So thinking through what the new modalities should be for appropriate training and responses, we'll be developing tools and resources there. And then finally, developing an overall best practice guide and resources for police agencies. But you know what? This has actually been very helpful for our team, because it allowed us to do a real scan of the entire field across disciplines to see what was working and what the different models and approaches were, and putting that all together in one piece to help inform our work, but also help inform the work of the field. So now into the meat of it here. First, that develop and evaluate training. The original training here is based on a 40-hour curriculum that was originally based on the Memphis model of crisis intervention teams. And what our partners at PRA and the ARC have been working on is taking that base model and then, of course, integrating the IDD component into it and updating this with best practices. It's didactic and scenario-based. There are now 21 different modules that cover all different topics, including mental health, disability, substance use, officer wellness, and de-escalation tactics and techniques during those crisis-involved encounters. And it integrates the perspectives from the police, behavioral health, and the disability fields. And that's why I have all of these partners working together to update this curricula. This is going to be a nationally available curricula, and again, funded by BJA. So my next slide, well, what are we going to do once we have that curricula? How about the training and technical assistance to go along with it? So we are delivering law enforcement training and collaborative crisis response. Here we're providing tailored technical assistance to help the planning and the support process to begin with, even just to get these models off the ground, right? So we're helping communities in that regard, but also to provide that training and evaluate that training along the way, assisting the development of police behavioral health and disability, and of course, community collaboration. There are so many different ways for police to engage, police agencies to engage with us and to receive that training. And of course, as Cornelia mentioned, there's going to be even more down the road as additional funding is being applied here. And I'll tell you right at the end, the website to go to get more involved and more information. So next slide, please. The third piece of this is to develop those additional technology solutions. So e-learning materials. Listen, everyone at the beginning of the pandemic thought, what are we going to do? How are we going to adapt? And what we realized was there's a lot of things that we can do virtually that will save time and money and can be done just as well. Now, this is not to say that we don't need hands-on training and in-classroom training. We absolutely do. And that's what our development of that 40-hour in-person training is about. But in addition, we want to supplement that work with lots of different technology, resources, and tools. So this will increase the accessibility and the feasibility for training, particularly in rural agencies. Now, for those that are joining us from around the world, you'll know that the United States here, we have such great variety in our law enforcement agencies. We have, oh gosh, over 17,000 different agencies, and the vast majority of them are actually small to mid-size agencies and may not have the resources to send officers to training for 40 hours a week. And so this provides more flexibility in that schedule, and it reduces the overall training time. Next slide, please. So the final piece here is to develop all those products, the resources, and the best practice guides, and put all of these things together, present this information, make it easy to use and available for the field. Identifying resources that exist already for police response, but then ones, especially for the research field that we have, where it's not readily accessible for law enforcement agencies and for communities, to make those resources accessible. And this will also help to inform the development of new resources, because we're identifying the gaps. What are the needs for law enforcement agencies and our communities and our behavioral health and IDD partners? Identify what those gaps are, and then we can better fill those needs moving forward. Next slide, please. Here's just some examples of the types of work that we're doing. So that best practice guide, for example, we've done a research on the field on first responder models, took a look at all that available research, gathered it all together, and we're identifying evidence-based and best practices and preparing those key lessons learned. And the next slide will tell you just some of what are we talking about with these first responder models. Well, we've identified and put into categories different types of first responder models, including dispatch response, law enforcement response, behavioral health response, co-response, and then community response. Next slide, please. So that dispatch response, for example, we're looking at specialized dispatch. Sometimes they're embedded or integrated dispatch. We have crisis call diversion, offender notification and flagging systems, all just within dispatch. We see all of these communities that are approaching things in different ways based on the needs of their communities. But the question is, what's working? What are the best practices, and what should we be doing moving forward, and how can we best support these types of approaches? For law enforcement responses, of course, we have crisis intervention teams and law enforcement assisted diversion. Those are very well-known programs here in the United States. Next slide, please. But we also have behavioral health responses, so mobile crisis teams, crisis resolution and home treatment teams as well. These are relatively new and coming on board here in the United States. We have co-responder teams, case management teams, disability response teams, and all of these are slightly different and have different approaches and different needs. And then finally, we have just straight up community response. And there's been a lot of move towards these responses and taking this out of the hands of the police and instead having that first responder be fire or EMS response or peer response rather than law enforcement. And so again, the effectiveness of these responses is going to be particularly important as we move forward. Another example of our work, we've been holding stakeholder discussions. For example, back in August, we brought all of these experts from all different areas in the field together. We held a roundtable 2 days virtually, and we actually wrote up key lessons learned from that. All of this information is now available on our website. We talked specifically about best practices and crisis response models. And we also have sessions just like we're doing today that are available on our website. Next slide, please. And then finally, we've been hosting topical webinars. So just last month, we looked at transforming dispatch and crisis response. We talked about the challenges and the innovation that's available. We looked at 4 programs specifically. All of this information, again, available on our website. So I keep referring to that website. How do you get there? Well, unfortunately, it's a really long name right now. We need to shorten this up, Cornelia. That'll be my job to make sure it's a little bit more accessible. But if you go to theiacp.org, that's the main webpage for our partners, International Association of Chiefs of Police, /projects, / and then you've got to do academic -training -2 form, etc. Police responses, you can see it here. We're going to shorten that up for you, but we are also making this available, and this slide and this whole presentation will be available to you. So you can click right on there, go to our web page. That's a way for you to access resources, apply for technical assistance and training, and to follow our work. The final thing I'll just mention is we are literally building this as we go. So there's going to be a lot of changes, but as soon as we get information available, we put it up there because we know there's such a need in the field right now. You can't wait we can't do it on academic time, right? You can't wait for a 3-year study to conclude to be able to get these resources. So you're going to see a lot of changes with this website as we go, but everything is right there that we have currently, and we'll be working away the next 2 years on this project as we move forward. So thank you so much for your time. Happy to answer questions after we hear from Terry Lynn, who's got a lot of detail about the work that they have been doing at Council of State Governments. And I'm excited to hear you speak, Terry. So.
Excellent. Well, I thoroughly just enjoyed listening to everything you had to say, Robin and Cornelia. And 2 hard acts to follow. Let's see what I can offer up. First, I have to learn how to do my share screen here so I can pull up my notes. And I'm making the assumption that folks can see that. Excellent. So again, it's, thanks to Cornelia and Robin for allowing me to be a part of this panel today to highlight some of the other great things that we're able to offer out to the field, thanks to the funding and our relationship and partnership with BJA. So I am Terry Lynn. I am the Deputy Division Director, Law Enforcement. I oversee at the Council of State Government's Justice Center based out of New York, and I oversee all of the law enforcement portfolio and our work. Today I'm going to highlight, in addition to webinars that we host and are providing technical assistance to the field, I want to specifically address a few products that are new and out there and available to practitioners and to the law enforcement community. And I'll highlight them as we sort of go through each particular section. A little bit about the Council of State Government's Justice Center. We're a nonprofit, nonpartisan organization that combines the power of membership, associations serving state officials in all three branches of government with policy, research, expertise to develop strategies that increase public safety and strengthen communities. And I think we've heard the message, very clear today that, law enforcement agencies can't do this alone. They need partners, in this work. And we are pleased to be a part of helping them create those partnerships. As I mentioned, the products that I'm going to sort of walk through and highlight are 100% funded by the Bureau of Justice Assistance. And again, we maintain a very close relationship with BJA, and everything that I'm going to present to you in the next few minutes is done in consultation with, BJA. Everyone's, putting in their feedback, their thoughts, and ultimately the products that we're going to highlight. So let's talk about the law enforcement mental health learning sites. This program is about 11 years old. It initially started in 2010, and it supports 9 law enforcement mental health learning sites who serve as peer resources to grantees and communities across the country. And I'll show you on the next slide where they're located, but there are some major agencies such as Los Angeles Police Department, Houston Police Department, Tucson, and we also have a full service sheriff's office in Madison County, Tennessee. We've got some smaller jurisdictions throughout the United States, a rural jurisdiction, and we also have a large university campus police department, the University of Florida, that brings in some of their unique challenges with their population, as a 24/7 open access campus, as well as dealing with the students and some of the other mental health issues that they may have to experience or encounter. We are going to expand the law enforcement mental health learning site program. We are currently working with BJA on that right now. And I'm going to encourage everybody who is here today to check back on our website and, when we make the announcements about some of the new agencies that are going to be joining this new cohort. And they really are, if you look at this map where we're located with our learning site program, from Portland down to Florida, out to Arizona, Texas, California, and up in Wisconsin and other places in between. As I mentioned, it really, they represent sort of the diverse, as Robin mentioned, over 17,000 police departments. They really kind of represent, challenges and strengths that agencies, may experience, large, medium, small, or even very rural. So we're very excited to expand upon the initial 2010 cohort, which on my map here are highlighted in light blue. And then in 2017, we expanded it even further, adding in the darker blue. And then, as I mentioned, we will be adding some more in as well. Now, because of time, I would love to talk about all of the learning sites. I mean, they do some really great work in this space. And, when we go back even 11 years, what some of these agencies were doing at the time was cutting edge in terms of how they responded to people who were in crisis. And certainly, in the past decade, training has, intensified across the United States. And if I highlight Tucson Police Department as an example, and you can see on that sort of arrow down the graph down the bottom, where they kind of expanded, started in 2000 to where they are when they came on board in 2017. They, as an agency, in Tucson, Arizona, they have about 850 sworn police officers. They utilize a variety of teams that make up their mental health screening team, their MIST team. That's co-responder teams. They've got crisis line. They've got a mobile crisis response. They do homeless outreach. They also are very unique because they have their own crisis response center that's right in the city of Tucson. And I was fortunate to go out and visit Tucson to actually see it in action, if you will, where a police officer can encounter somebody who needs some services and they can bring them directly to the CRC. They go in through their own little sally port, and they pride themselves on the fact that the handoff, getting somebody off the street and then into treatment for stabilization is less than 30 minutes. So they've found that it's an extremely cost-effective way to have an officer be able to render aid and assistance to somebody who needs it and get that person into services very, very quickly. And then from there, they can also get access to a mental health court. They can also, deal with any outstanding legal issues that they may have so that they can try to focus on their treatment and rehabilitation. Again, wonderful model that exists and is out there. And visiting the learning sites is available to law enforcement agencies across the United States. They are willing to share their best practices. They're willing to share sample MOUs. They love talking about the great work that each of them are doing. And we are able to facilitate those site visits, if you will, for agencies. And I'll show you how you access that information shortly. Now that we're doing things virtually, we've ramped that up, so it makes it a little bit less travel, and we can bring that directly to you, where your agency can bring in as many people and ask questions and see what some of the great work that the learning sites are doing. You can click on the Law Enforcement Mental Health Site Program, and it'll bring you directly to our website. The National TA Support Center. Very excited about this. This is brand new, just launched in January. And this is a free center that provides training, resources, and support to communities wanting to improve their law enforcement responses to people with behavioral health conditions or intellectual and developmental disabilities. You can just click on the link. It'll bring you to our National Support Center. We offer on-demand support. We will, member of the team will get back to you within 3 business days. And some of the types of technical and training assistance that the center will provide can be light TA. Maybe it's just a connection to a police agency or sharing a sample MOU. We can do a more intensive process where we can actually set up visits, arrange meetings, and put you in contact with our subject matter experts that we are partners with in this project. And then we also provide a level 3, really intense sort of review of an agency's program. Maybe they want to start a program and they just don't know, how to begin this process. And that's where we can step in. We can work with the agency. We can set up all the meetings. We can advise you on partners and resources that you really want to have at this, in this partnership to move forward. And that is something that the center will provide to you. Again, making those peer connections and providing you contacts with some of our other partners. The link is available there for all of you as well. All of this, a lot of this is based on, in our work with BJA, the Police Mental Health Collaboration Framework. And if I did it correctly, I've uploaded the PMHC framework for the audience members to have access to, but it's also available on our websites and through the National Center as a PDF that you can access and download as well. And the PMHC framework, for those that may be watching this webinar, they just don't know sort of where to start. This is a great place to start because it is written for law enforcement executives. It's designed to really, based on the top sort of PMHCs that are currently out there in the US, and it shifts the focus away from standalone training or small scale programs and teams toward agency-wide collaborative responses and metrics-driven performance management. And the third thing that I want to sort of highlight today, and Cornelia and I were talking about, the PMHC self-assessment tool and a way to present this in this particular format. And I didn't think a demonstration, with the web was going to work. So Cornelia's seeing this for the first time, and hopefully it does what I intended to do. The self-assessment tool helps law enforcement agencies and the behavioral health partners assess their current progress towards implementing high-quality partnership-based interventions. Now, this web-based tool is designed to provide tailored resources based on a jurisdiction's assessed level of implementation, and can also provide the jurisdiction access to resources. And it just gives a nice little snapshot of where the agency is. Going back to my PMHC framework, the PMHC self-assessment tool is, we base it on sort of 6 sections. Is the leadership in the agency committed? Are there clear policies and procedures that exist? Is there quality mental health training that is provided to clinicians, to the officers? Are there community-based mental health services and supports that are currently available within that jurisdiction or within that region? Does the agency collect data? And if so, what do you do with that data? And do you continually use it to evaluate and reevaluate your program? So when you go into the web-based tool, you will be met with a screen where it will ask you to create an account. We're asking folks that use this that you be the one who's directly in charge of your partnership or creating your potential program. You'll be able to create the account. We have uploaded close to every police agency in the United States. So it's fairly easy to use. When you go in to create an account, you'll be able to sort of scroll down, find your agency, and then create an account. Now, the tool is limited currently to 1 account per agency, but if you have 2 or 3 members that really want to have access to this, all you have to do is reach out to me, and our team will make sure that that happens for you. And we also heard from behavioral health providers and clinicians who said, well, I'm going to be working at the police department. I would like to have access to this tool as well. So we've also created that function for clinicians, and all you have to do is reach out to me. So let's walk you through this visually appealing website. So I mentioned the 6 kind of questions, and we have little sub-questions built in there as well. And we use this color-coded scheme where you're able to go in there and check off whether your agency, has implemented it. Maybe you've thought about it, or you're taking steps towards implementation, or maybe, it just hasn't happened yet. For example, let's say your chief has said, we want to do this, I support this, I'm going to dedicate personnel and resources. Great, fantastic, right? You're in that, partially implemented, fully implemented model. So this is one of the questions, as I mentioned, is the leadership committed? And some of the things that you will go through in this tool is you'll see, who are the champions? Is it the chief? Is it the sheriff? Do you have the president of your local hospital or somebody else that's going to be a part of this partnership as well? Have you established an interagency work group? You know, have you brought together some of the stakeholders to engage in initial conversations? And this tool will allow you to walk through and check sort of where you are in that process. As you go through, you'll be able to download other resources. So let's say on one of the questions, for example, does your agency provide recognition to the officers that are involved in your CIT or your co-responder model, the clinicians that are involved, or maybe you don't know how to do that. Well, when you go through this self-assessment tool, you can actually click on some resources where you can find examples of agencies that are doing recognition, or that have a good field guide that's available to the agency. This library, as you go through this tool, will fill up for you so that you can see in this test slide over here on the left, these were some of the questions that people said, well, we want to know a little bit more about public demonstration or partner commitments or MOUs. And what you're able to see on the right is that you can collect a lot of additional resources that can help inform you and your agency about how to address some of these questions that maybe you needed further examination or explanation of. At the end, you are able to see where your progress is. How do we look? You can share this link with your chief, with your sheriff, with other stakeholders. You can go back in and make edits. And let's say you start the process and obviously it's a very busy time for law enforcement and you need to come back to it. We will send out reminders automatically every 45 days. Hi, you started this the self-assessment. Would you like to come back and finish it up? So it's a great tool to use, and you can always come back and revisit. You can always share this link with everybody else in the organization, and requesting free support, much like requesting assistance from the other products that I talked about, will come directly to my team, and we can assist you from there. And those are some of the great, exciting things that we have created in partnership with BJA that are available to all of you that are in attendance today, and everybody that's out there in the field across the world. Cornelia?
Yeah, thanks. We're happy. Thank you both. Those were great presentations, and I'm happy to take questions from anybody. I think one of the questions, Terry, is how it looks like Reading, Massachusetts would like to be included on the list of agencies. So how an agency could get included on the list if they're not on there already. So.
Yeah, excellent. My contact information is there for the audience. I've made the slides available as well. Cornelia, all they have to do is reach out to me, and we will manually add that. And our apologies to any agency that may not be listed. I think we had last count 17,400 and something were in there. So we're close, but just let me know. Okay,
great. And I wanted to just reiterate the point I think that you made, and Robin as well. These services are available to our public safety agencies for free, for no cost. So as participants heard about the different learning sites, we are able to support travel for folks who would like to go in person once that's a little bit more available after COVID. We can set up virtual exchanges, so we can fly experts out to your department to meet with you at no cost. So I often get asked, what does that mean? And I think the real world answer, really is your chief asks you to put together a program and you don't know where to start. This is a great place to start, because we're able to help you figure out where you are, what you need to do, and put you in contact and be able to go see other programs and how they're functioning. So are there any other questions? Let me see here. I don't see any in the chat. Anything you wanted to add, Terry or Robin?
Well, Terry, I was impressed with your presentation. This is the first that I've seen the new portal too, so I'm excited. I can't wait to direct the agencies that we're working with right there to you folks too. So this is a great way for us to collaborate.
No, thank you, Robin. Yeah, again, it's super, we're just super excited. It's been a wonderful relationship creating these products with BJA and to make them available to the field. We just know that it's going to make a big difference to law enforcement agencies today.
And one of our sort of mottos that we live by is to make these resources as accessible and easy to digest and brief, because none of us have time to read, you know, voluminous documents. And so really with the assessment tool, that's the purpose, to be able to kind of take your Marie Claire type quiz, go in there and get the information as you need it. So, and lots of other documents and resources. And Robin, in terms of your best practices guide, which I know is going to be just a huge benefit to the field, when are we going to, what's the timeline for starting to release those documents?
So what we've decided to do with the best practice guide is we've developed it into chapters. And as the chapters are available, they've been put on our website, but they are academic in nature. And so we're working with IACP right now to take what we've pulled together in these chapters and then make it much more user-friendly. And so that's ongoing work as well. So if you keep checking back on our website, they're going to be coming available over the next few weeks. But there are some chapters that are currently available on our website.
Great. Well, if there are no other questions from anyone, I don't see anything in the chat. I guess we'll wrap it up. Thank you both for presenting with me, and thank you to the audience for listening to us. And hopefully next time we can actually do this in person and it won't be on Zoom.
Very good. Thank you all.
Thank you. Thank you.
Bye-bye.